Part B, questions 25 to 30. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. Now look at question 25. You hear a nurse in the emergency department discussing the care of a patient with a doctor. Now read the question. So, who have we got here?
This is Adam King. He was brought in with a dislocated shoulder. He has Marfan syndrome, so we've seen him before with this. Last time he was here, the shoulder popped back in while we were putting his arm in a sling, and he was able to put it back in himself just by relaxing his muscles, but he's in quite a bit of pain right now, so he's having trouble calming down and getting those muscles relaxed.
Right, I see. So, do you want to start with some nitrous and some pain relief?
Yes, I think that's best, just until he calms down.
Question 26. You hear a trainee doctor discussing a patient diagnosis with a tutor. Now read the question.
Let's have a quick chat about the diagnosis for Janine in Ward 2.
Yeah, I was a bit unsure about that one. Because it's a young patient, it's not going to be diverticulitis or...
Well, it's possible, but she is young, so yeah, it's unlikely. So, what do you think? What else could it be? What else happens in the bowel? Something common. Think about common things.
Bilateral lower abdominal pain? Because it's like radiating into the back?
Yeah, something very much more common than that.
Gastroenterological?
Yeah,
I can't think.
possibly related to diet?
Celiac disease?
Perhaps, but there's not a lot of other symptoms pointing to that. What else would give you discomfort in the bowel? Lower abdominal pain.
I suppose if they're just constipated.
Right, yeah, constipation.
Question 27. You hear a hospital nurse briefing a colleague about a patient recovering from elective surgery. Now read the question. So, who have we got in bed 8?
Bed 8, Mr. Bernard Chambers, a 50-year-old man, had an elective bilateral inguinal hernia repair this morning. His wound is covered and dry and his post-operative observations are stable. Temp is 37, his blood pressure 140 on 70. He's already started eating a little and his walking is tolerated. Analgesia is written up, but he hasn't needed anything. He's planned for discharge tomorrow. His wife can pick him up. And he'll need a sick certificate for work before he leaves. Can you make sure he gets that, please? I asked the ward clerk to copy some post-op information for him, but I haven't had a chance to look through it with him.
Question 28. You hear 2 hospital managers talking about an information session for people who want to do voluntary work. Now read the question. So, how's the planning going for the future volunteer information evening?
Well, we've had a lot of RSVPs already, so I'm really happy with the way the event management systems have worked. Having a bit of trouble sourcing some good catering, though. Considering that these people are freely giving their time to come and learn what is expected, I really want to provide some nice food and refreshments for them. Have you got any contacts you like using?
Yeah, look, that's right. It's a small thing we can do for those participants. I'll tell you what, I'll ask around my team for some recommendations for something a bit special.
Great, thanks. I really appreciate it.
You hear a pharmacist talking to a doctor about a patient's medication. Now read the question.
Sorry to bother you, Dr. Anderson. I just wanted a quick word about Mrs. Campbell's prescription. The one for diphenhydramine that you gave her last week.
Ah, yes, for her allergies.
Yeah, so she's been taking 50 milligram tablets for about a week now. The thing is, she's just been into the pharmacy and she says that the tablets are making her feel really drowsy and her mouth's really dry ever since she started on the pills.
Really? Well, that does happen from time to time. But maybe switching her onto a different medication wouldn't be a bad idea.
Okay, I'll look into some options and then run them past you later, shall I?
Fine, thanks. Question 30. You hear a doctor advising a patient about a change in medication. Now read the question.
Now, the good news is that I don't think that antibiotics are going to help, so we don't need to think about those. And what I'll be advising actually is, from now, I'll be advising to start with a daily antihistamine. It's called cytarabine. I'll write that down for you because it is cheaper to buy than it is on prescription. And it probably is the number one choice for, I hope you don't mind this bit of scrappy paper
That's okay,
here.
that's okay.
The number one choice for hay fever at this stage. This is 1 tablet a day. Now, for most people, it's absolutely fine. One person in about 100 gets a bit drowsy with this, so if you find when you've taken this that you get drowsy, then it could be this, and we maybe need to think of other options, and we'll come back to talk about that.
That is the end of Part B. Now turn over and look at Part C.